What is your name?
Dr. Rachel Silverman.
So, why did you become a therapist?
Because I've always thought psychology was interesting, and I thought I enjoy being around people and talking and people, and helping people help themselves.
So, what are your degrees in?
I have a doctorate in clinical psychology, and I will be board certified in couple and family psychology by August.
Dr. Silverman stated that she became a psychiatrist because she loves being able to help other people and impact their lives in a positive way. Dr. Silverman believes in using an eclectic approach to specifically help each one of her patients.
I have an eclectic approach. I would say I meet my patients where my patients are at. I use, cognitive behavioral therapy and other modalities, whatever the patient really requires. Sometimes.
Dr. Silverman graduated from Emory and she graduated with her degrees in all three bachelor's, master's, and doctorate degrees. My first point is that you have to put in a lot of time and effort to be a therapist. She was accepted in Nova Southeastern University's doctorate program after she graduated from Emory. She had an internship at a prison for around 1 year and told it was 7 years post-undergrad. She was a licensed doctor by the age of 28.
For a year at the prison, and I had my own. I had two wards that I ran with a team, and I had about 60 patients, all charged with felonies.
So what made you want to go? Dr. Silverman stated, lots of effort and time to be a psychologist, but it was so much fun. It didn't feel like work, and the 7 years flew by. My second point is you have to have a good connection and relationship with the patient to understand how to treat them. Have a relationship with each and every one of her patients so they feel as if her office is a safe place to be. She then chooses a different approach of treatment for each patient depending on their situation. How do you decide which approach is best for your patients?
It depends on what the patient's presenting with. If the patient has, let's say, a complicated family history, and it's a family that's coming to me, and I'll use family systems approach. If the patient has anxiety disorder or depression, typically I'll use cognitive behavioral because that's evidence based.
Dr. Silverman stated, I connect with my patients by meeting them where they're at. No judgment and a lot of empathy. It's about warmth, respect, and empathy. My third point is medication is only used when necessary. Dr. Silverman believes to only use medication if it's necessary and urgent for the patient. Dr. Silverman stated, I feel it is necessary to use medication when a patient's mental illness is interfering with their ability to participate in therapy. For example, a woman was suffering from severe mood swings. She couldn't regularly attend treatment because her depression wouldn't allow her out of bed.